So the MADIT CHIC study is a really unique study. This was a study which looked at chemo-induced cardiomyopathy. So this is patients who actually are cancer survivors and then go on to develop heart failure because the chemotherapy they used eventually attacks the heart in some way. So these patients, it's like a double whammy where they develop heart failure after surviving cancer. And the MADIT CHIC study was largely looking at the role of cardiac resynchronization therapy in these patients who develop chemo-induced cardiomyopathy. So these patients who had a low ejection fraction of less than 35%, had a wide QRS, were symptomatic on optimal medical therapy, were then given the option of cardiac resynchronization therapy, and we were then able to determine how well CRT behaved or how well these patients behaved in response to CRT. And our findings were really interesting. Our findings showed that these patients actually did quite well with cardiac resynchronization therapy. There was significant remodeling of the heart, that is, the ejection fraction actually improved quite significantly. And along with that, they also had an improvement in their clinical status. So it's really important to recognize that this is an orphan patient population. They have an oncological disease, and then they land up with a cardiac disease, and they've not really been, I would say, looked at in greater depth and detail within the large clinical trials so far. So this was unique from that perspective. So as I mentioned, patients who have chemo-induced cardiomyopathy are an orphan group of patients. They've not been well represented in clinical trials. So nobody really knows how well they could have responded to resynchronization therapy. So this was, again, I think it's important to mention that we studied 30 patients from 12 cardio-oncology centers, and we were able to demonstrate this beneficial effect. And I think what it shows is that these patients can actually do quite well if they get cardiac resynchronization therapy in time, and they should not be written off just because they had cancer and now they have heart failure. So one of the things I mentioned earlier, that patients who have chemotherapy-induced cardiomyopathy are an orphan group of patients seen by oncologists and by cardiologists independently, oftentimes not having a really good collaborative relationship there to really look after these patients well. I think what we need for these patients is to kind of understand them better. We do know that there are certain chemotherapeutic agents like anthracyclines that hurt them more. We do know that patients who have breast cancer, lymphomas, or sarcomas have a higher propensity to develop chemotherapy-induced cardiomyopathy, largely because these medications like anthracycline can have this untoward effect on the heart. What we don't understand is the molecular underpinnings, is why some patients are more susceptible than other patients. And I think getting a better handle on that, having better cancer surveillance strategies, and getting the cardiologists and the oncologists to work together, I think can serve this patient population better.